the incidence of hepatocellular carcinoma is increasing both in the United States and worldwide. And actually, although in terms of general cancer statistics, there's actually been a general stability in cancer incidence over the past several years and a decline in cancer-related mortality, hepatocellular carcinoma has emerged as the third leading cause of cancer-related death in the world. And there are some generally well-known and well-characterized gender differences that exist in hepatocellular carcinoma. So we know that HCC is more common in men than in women at a ratio of about 4:1. HCC is, in addition to that, men present at younger ages than women do. Men present with later stage disease than women at time of presentation, and men also undergo transplantation more than women do. And so although women are generally considered this kind of lower risk population just because of the increased overall prevalence of HCC in men, the specific risk factors for development of HCC in women have not really been that well studied up to date. So the objective of our study was really to better characterize the gender differences in HCC, and our goal was to use a large multi-center study to do that. So our study included 5 large academic medical centers in the United States. All of them are large tertiary care centers. 4 of them are liver transplant centers, and 1 of them is a cancer center. And we had a cohort of 5,327 patients, of which 23% were women and 77% were men. And in terms of what we found, since a lot of the literature that's out about HCC has actually been in kind of the cancer and oncology world, and there's not as much that's out there from kind of the hepatology perspective. And since we are a group of hepatologists, we kind of looked at some risk factors specifically related to underlying liver disease. And so one of the things that we found specifically in terms of looking at kind of the differences between men and women, we found that a lot of the things that we already know, our study corroborated that. Again, HCC is more common in men than in women. In our study, men presented younger, men presented with later stage disease at time of presentation, and men underwent transplant more than women did as well. Women were more likely to be treated with resection than men. One of the things that we found that was really interesting, though, is when we looked specifically at underlying etiology or underlying cause of liver disease, we found that the second leading cause of underlying liver disease in women in our cohort was non-alcoholic fatty liver disease. And it was much more common in women than in men. About 23% of women in our cohort had non-alcoholic fatty liver disease or NAFLD, compared to only about 12% of men. And then in addition to that, we also found that a lot more women in our study compared to men presented with HCC in the absence of cirrhosis, and HCC usually presents in patients with some sort of underlying liver disease and is really most common in patients who have end-stage liver disease or cirrhosis. And so not surprisingly, a predominant feature in our cohort was the presence of cirrhosis, but we found that women were much more likely than men to present with HCC in the absence of cirrhosis, which is interesting and certainly suggests that kind of there's an unmet need there, and women are certainly, at least from that perspective, seem somewhat underserved by kind of our current guidelines. What does that mean for screening? So it's a great question, and that's kind of the question that everyone's trying to answer right now and we're actually, one of the reasons we looked at kind of this evidence, presence or absence of cirrhosis, is because this is really an area of emerging interest. And so given that our study was retrospective, our patients were followed, the data we have on our patients is from only within 6 months of date of HCC diagnosis. And so since patients were not followed longitudinally prior to the development of HCC, it's difficult to say how it had the true implications it has for screening and screening for HCC in women and certain underlying etiologies of liver disease like NAFLD. Although it certainly suggests, a lot of the literature out there does now, that there certainly seem to be kind of other underlying risk factors that need to be taken into consideration, and that we need to kind of, it supports the ongoing research efforts to really delve more into this and kind of really ideally get kind of a prospective longitudinal cohort of patients we can follow over time, and watch them as they develop HCC to determine what those true risk factors. One other really interesting and important thing to look at was that we did not characterize, in our study, we did not characterize women by menopausal status. And estrogen is felt to confer a protective effect both in hepatocellular carcinoma and in non-alcoholic fatty liver disease. So characterizing women by hormone status would actually be a really important thing to do and kind of like looking forward, just given the very high rates of NAFLD in our patient population and really particularly in women. That would be a very interesting and important thing to look at as well.